All right, so I'll go ahead and share my screen. So the first page, really just that table of contents. This is clickable, so folks will hopefully be able to navigate this document fairly easily. This is this big enough for everyone to see, by the way? Okay. This is the most up-to-date version of the collaborative description, the paragraph that this group put together a while ago that's gone through a couple of edits while we've worked on this process, but no major changes other than what we ran by you all a couple weeks ago. And then to get into the meat of it, so our objective is to effectively and efficiently communicate the activities and projects of the collaborative to both internal and external stakeholders. We developed these intended outcomes, including develop a visible profile, increase awareness of the collaborative's mission, work, and the desired outcomes, consistent use of messaging and language among collaborative members and their teams regarding retail food safety initiatives, record and maintain an accurate timeline of projects, programs, and events developed and hosted by the collaborative, visible communications on social media and via email directing audience to news, event information, and educational and professional opportunities, host conversation and information sharing within our community, enable collaborative to meet communications deadlines, and inform collaborative members, partners, and stakeholders of upcoming communication outreach activities. I'm going to go ahead and skip over these points of contact for right now because I think that will potentially change depending on how we feel about the procedure that we'll go over. But for right now, it's just kind of been the folks who are on that communication plan working group. For our scope, we really just took some time to contemplate all of the channels, avenues, media, et cetera, that are available to us. For internal communications, we liked the idea of having an internal email list, so that'll be something to develop over the next couple of weeks. We also have the collaborative, the official collaborative meetings that we can run information through. We have the JAG, we have the quad calls, and we also have association meetings for each of our various associations. For our external channels, we have the website, social media, Facebook, LinkedIn, Twitter. We do have an email list, and people can sign up for that via the website as soon as it goes live. We also have conference presentations, which we know are in the works, and other association meetings like the Food Safety Summit, the Food Safety Consortium, and the International Association for Food Protection, etc. We have webinars. We also have some media outreach available to us, such as AFTA's general media releases. We can do spokesperson interviews, media conference calls, and desk side. We can also do email blasts as appropriate to our stakeholders, especially regarding webinars and podcasts. And we also have some congressional connections that allows us to do things like individual calls and representative meetings. Does anyone have any questions so far?
Taryn, I'm not familiar with desk side.
I am not either.
Okay.
Does
All right.
Brooke or anyone?
Me neither. Mm-hmm.
A desk side is an interview opportunity with a single reporter or editor where you go in and make the appointment and you sit and you can talk different topics with them. So it's some newspapers require you to go in front of the editorial board. With COVID, most places are having you do desk sides, which are over Zoom, obviously, with reporters that it's more about bringing them up to speed on your overall efforts rather than, hi, this is a news story.
And then another thing I thought with the, I know we're going to give you feedback, but where quad is used, I don't think most people know what the quad is except for us, even within the collaborative group. So we may want to just clarify what that is rather than use.
So back to the desk sides, could we just add desk side media interviews? Or maybe we, instead of calling it desk side, call it, for people who don't know the lingo, one-on-one media interviews or backgrounders, either one. It doesn't need to be capitalized.
I think one-on-one media interviews makes a little bit more sense to me as an outsider.
The only bad thing about interview is it tends to make you think they've come to you, and that's not what this is.
If we put maybe touch points, would that maybe make it less?
Yeah, or editorial briefing, background, or something like that, where we're taking the initiative rather than they're taking the initiative.
By the way, Stuart's here. I was not able to log in via my phone or my computer, so I had to call in.
Oh, wow.
I'm glad you were able to make it, Stuart. All right.
And
Anything?
looking at you guys, I've not looked at this in a while. I'm really impressed by the way this looks. You guys have done a great job putting this together.
Thank you. So I don't necessarily want us to save all of our feedback for the end. I think there'll naturally be some of that anyway, but I'm happy to stop at any point. Just let me know, because it is kind of a big document. So I don't want to get super far away from something and have someone feel like they weren't heard. So we also took stock of our target audiences. Internally, of course, we have all of our associations. And externally, we just kind of updated this from, I'm not even sure where the original list came from, something early on in the communications working group materials. So we just made a little note that each member organization has a role in communicating collaborative activities and outcomes to their stakeholders. A summary of the retail food safety and environmental health professionals and stakeholder groups represented by each organization are indicated below. So we've just cleaned this up a little bit and standardized it.
This is Nelda. Since I came a little later in the picture while this was being developed, so these are each organization supplied their stakeholders. Were you expecting FDA also to be on that table together with the CDC too? Or was this only for the external organizations?
That's a really great point. I think the original list that we were working with only included the 4 organizations.
Okay.
But if this is something that FDA and CDC wanted to provide, I do think it would be good to have them included on the table as well. Again, as equal partners in this, I think it's good to have representation of everyone.
Yeah, this was developed, I think, like really early on, like right when I had just come on, we were talking to each association and we're like, who are your stakeholders? And this was from a really early on document, I think, like that Brooke and some others put together. But yeah, I think adding CDC and FDA to that would be great. That'd be a great way to highlight the entire collaborative.
Okay.
Any other thoughts on this part? Okay. One thing that I think has been really important to everyone moving through is how do we measure our success? So we also built in our performance indicators here. A key performance indicator, or KPI, is basically a measurement of performance. KPIs evaluate the success of an organization or of a particular activity in which it engages. In this case, KPIs are used in communication to validate the effectiveness of both messaging as well as the methods used to deliver it. The use allows for correction or reframing of efforts to improve effectiveness of all the organization's efforts. So we have some pretty common ones here, and we've built in this idea of being able to measure our success from the ground up with all of the collaborative channels that I've developed so far. So the website has a lot of tracking, the email system that we'll be using has a lot of tracking. Social media obviously tracks pretty much everything you do. So we're just taking some numbers from there that are already going to be pretty available to us. So email open rates, including collaborative emails and individual partner email distributions. We can look at the site usage, including visitors, bounce rate, stickiness, organic web traffic. We can also see how many people are accessing the site on mobile versus desktop, as well as the landing page conversion rate. We have social media, so follower count increase, impressions can be a little bit difficult to measure, but seeing an increasing number in Google Analytics can be used as a metric. We can track our web traffic from social media posts, and we also have our media relations, so the number of media outlets contacted, the pickup of media releases, and we can also keep an eye on media inquiries. So far the thought was that these KPIs will be tracked monthly by the communications team member managing the website, and collaborative social media feeds and recorded in a spreadsheet available within the collaborative communications Basecamp. So currently, I'm the person who will be managing all of that, and I have the easiest access to all of that information anyway. Any thoughts on KPIs? Cool. So moving into materials and tactics details, the communications team will use Basecamp as their primary hub. Communication request worksheets and a communications calendar will be housed there. All messaging requests will be translated into the communications request worksheet, which will be stored on the collaborative communications Basecamp schedule. All of the information related to each communication request will be stored on the worksheet. So in theory, anyone could open that Word document and see kind of beginning to end, here's the request, here's all of the tweets, all of the social media, here's the email we're going to send out about it, here's all of the people who've had a chance to review this, and here's the timeline for that. So that should be pretty comprehensive. There's also a list of the forms that we've developed and their use here. So we have the communications request form, which is what allows the members of the collaborative, members of partner associations or outside entities to submit requests to have messaging sent through the collaborative's communications channel. This is an online survey available on SurveyMonkey. But we also developed a Word document of this form because it is a bit of a heavy lift for folks who aren't familiar with communications. So they can use that as a tool to help prepare those who might want to fill out the form for the questions the form will ask. We also have the communications request worksheet, which is the template the communications liaisons will use to track, edit, and complete communications requests. And I think I'll go through the procedure really quick before I stop there, because I think that tactics and materials doesn't make a whole lot of sense as a standalone section. So some definitions to get started. We have the communications working group, and we are looking for a definition for this because it was kind of brought up that those who are working on the communications team, at least in terms of the plan that we've developed now, might not be the same as everybody who's on the communications working group. So the communications team will be comprised of identified representatives from each partner association supporting collaborative communication efforts by participating on the communications working group and as a communications liaison. A communications liaison is an identified member of the communications team assigned to work with other members of the collaborative, either to finalize and approve messages or as a member of a project group to represent a communications perspective. We also have the approver, which is a member of the communications team responsible for maintaining the collaborative communications request form, notifying communications liaisons of new communications requests, providing final approval for messaging, and posting messages to the appropriate channels, such as social media, email, or the collaborative website. The approver position is housed by the National Environmental Health Association as a part of the National Environmental Health Association approach to reducing foodborne illness via promotion, communication, and support of retail food safety stakeholders in collaboration with partner associations, grant number, U.S. Food and Drug Administration. So the approver position does not rotate, unlike the communications liaisons. So for the procedure, all members of the collaborative and partner associations that wish to send messaging through the collaborative channels are asked to use the online collaborative communications request form. This form should be filled out as thoroughly and early as possible. Members of the collaborative who are working on the collaborative projects, such as research, resource development, assessments, etc., are asked to notify the collaborative communications team at the beginning of the project so that a collaboration or a communications liaison may provide communication support during all stages of project development. So we'll have a bit of an on and off rotation for this, which we're calling the rotating buddy system. Communications liaisons work in a 2-month rotation of a team of 2 to help with approving messaging and publishing messages. It is anticipated that this rotational schedule will ask for approximately 1 to 2 hours per week of time on communications from each member of the communications team on a regular basis, with the expectation that the number of hours may be higher for major events. So I think instead of reading this workflow, I'm going to go ahead and show the flow chart because I think that might be a little bit easier for folks. Of course, now it's not giving me the option to share that one particular screen.
Sharon, I was going to ask a quick question, and it may be, I haven't looked at this language in a few minutes, but is it, oh, there it is. But I was wondering with the, with notifications, are those built into the system, or does the communication liaison have to create those each time? The notifications back to the submitter of the request?
So because the survey is housed on SurveyMonkey, we do have the option to have new requests go directly to the communications liaisons. But I think if we can have it sort of funneled through one person, it allows them to kind of keep track of where we're at in the process. So it's a little bit of extra work for the approver the way that it's set up right now, but currently it does have those notifications come from the approver, who's the only person receiving notification from SurveyMonkey.
Thank you. I was just wondering if they were standardized as well, or just.
Certainly. So I'm not sure if this is readable, but maybe like this is a little bit better. So the text kind of in black here is just explainers. So I'm going to go ahead and skip over that because that was sort of included in other parts of the communications plan document. So effectively from the beginning, when a new project is initiated, we have 2 ways that it can go. The first one is to this point of contact fills out the communications request form, the internal version. That version is very simple, just what are we doing, what's it called, who's in charge of it. And that kind of lets the communications team make educated decisions about how involved or not they want to be, whether this is something that might go out in, for example, an internal collaborative email list or something like that. Just gives us a heads up about what's happening. As the project reaches the point of being ready for external communication, the point of contact will fill out the communications request form, the external version, which is the one that's a lot more thorough and in-depth, and allows us to start the process of running everything through approval. So alternatively, an outside association or a partner association, such as an AFTO project that's not directly funded by cooperative agreements, would start at this point as well. So if they have a marketing request that they want to submit via the collaborative channels, then they would go straight to filling out the communications request form externally. So from there, the approver is notified of the new communications request. They'll translate that request into the communications request worksheet, and then they'll send that along to the 2 communications liaisons who are on buddy rotation at that time. The communications liaisons will decide between themselves who will be responsible for ushering the request through the approval process, and then they will notify the approver that that decision has been made. From there, the communications liaison works with the point of contact to clarify, polish, and approve the messaging. The communications liaison works with the other communications liaison on the buddy rotation, the approver, and other association members such as leadership or project leads as needed. And throughout this process, they are also responsible for maintaining the communications request worksheet. as well as a review history and relevant information pertaining to the request. The communications liaison then approves the messaging once they feel like it's up to standard and ready to go. They then send that messaging through to our FDA communications partners. So those requests will go to, at this time, Nilda, Stewart, and Chris. Our FDA communications partners are then responsible for ushering the messaging through the FDA internal review process, and they have shared with us that it's a two-stage process. The first stage is going through the ELAT, and the second stage is going through their communications team. We still don't have a finalized timeline on this stage 1 yet, but stage 2 is a pretty quick process, usually about 72 hours. From there, our FDA communications partners will send approval and communication request sheet to the approver. And the approver then adds the messaging to the calendar in Basecamp, schedules the messages on various channels and media as appropriate. And then the approved messaging goes out on collaborative channels. Typo. So that's kind of the overview, and that is what the communications plan says as well. Oops. So I'm going to go ahead and stop there. Does anyone have any questions or concerns about this part?
So we are saying that every communication, I asked this before, I think, every communication that each of us has, is this just for collaborative? Or if AFTO wanted to do something, this is going through this process?
If AFTO wants to do a communication that is not related to or not funded by the collaborative projects, it will still need to go through this process. But if AFTO wants to do a marketing request through like NEHA and not through the collaborative channels, then this process has no effect on that.
Okay, so I asked this before, if we've already gone through the vetting process with FDA or CDC, why do we have to do it again?
That's a really good question, Brooke, and I think that's one of the questions that we're going to pose to the collaborative when we bring this draft to them. We were asked to create this plan. This is what we've come up with, and then along the way we've gotten some feedback that FDA does want to see the messaging. So I'm hoping that once we submit this to the collaborative and FDA and CDC can see what this is, that we'll get some real feedback and hopefully some clarification on the needs of communications, how much, how little, how often. I hope that that can get cleared up in the next couple of weeks.
And this is not, I suspect it has to do more with media, you know, like press releases and tweets, that type of communication, anything that goes to the media.
And this is David. I'm especially concerned about if we don't know, we know stage 2 with the FDA communication team is 72 hours thereabout, but stage 1, I mean, we know from the CFP board meetings that we have one of the FDA staff, Glenda Lewis, has to provide a report to the board, and the amount of time it takes just for her report to our executive board to be approved. So that's just one of my concerns. A time delay.
Yes. Well, when we were talking to our press office, they, you know, 72 hours is the max that they said for tweets. They said 15 minutes to 24 hours. For press releases, probably a little bit more, but they asked that these, yes, that at least give them 72 hours in advance for something bigger, like a press release or. But yes, I totally understand your concern, and it's currently being looked at too. Mm-hmm.
And we have suggested too, and we're trying to see what happens to get it to be a concurrent review. so that when it goes through our press process, that at that time it also goes to the ELAT, rather than going to one and then to the other. So hopefully we'll have success with that.
I think if this is the way we're going to go, there needs to be definition of what's going to go to FDA. More definition. Because when I read this, I don't see this as just media releases. I see this as everything. And I feel like that could end up being a barrier for people to even ask.
My understanding was that FDA was asking for review of everything, not just media releases, but that media releases are particularly important.
And I think that, sorry, this is Laura. I do think that this is still a topic of conversation with FDA. There have been several meetings around communications, how best to communicate internally. So I just want to stress that this is what we were asked to create, and we'll see the feedback that comes back. Taryn and I were discussing this. There's going to be a lot of things that come through. I want to tweet about the NEARS Explorer program. I want to tweet about randomly about the food code adoption toolkit that's out, because we need to get some more people on that. So I think that this will kind of evolve, and once we really get moving, FDA and the collaborative will see how much messaging we have coming through here, and they'll need to decide what's the most important that needs to go through review, and what can we freely talk about on our own. So I don't think that this is the end all be all, but I think these questions and concerns are really important to highlight when we share this this document and this process with them.
I'm happy to switch back to the other document if we feel like we're done with this particular flow sheet.
Taryn, can you share that flow sheet with us?
Yes, definitely.
Thank you.
Of course.
And Taryn, I know you caught the typo for channels in that lower left-hand corner, but to the northeast of that, in the box with the outside association or partner association, the word preforming, I think this should be performing. You read it.
Thank you.
Yeah, you're welcome.
Oh, yes.
Not doing spell checks right now, but at least I'd say no.
No, that's okay. The unfortunate thing about design software is that it's very bad at spell checks, and I am also very bad at spell checks, so it happens. Thank you for letting me know. Okay. So we have this written out here. It doesn't differ from the flowchart that I just shared, but I'm happy to read through it, or we can go ahead and move on to the next section.
Move on, save your voice.
Okay. So we do have just listed in here, and again, kind of covered by the flowchart too, but just if it's a high visibility promotion, something like the Food Code Adoption Toolkit, there may need to be more of an all hands on deck style approach to help. But we're hoping that just one or two people can handle most of the day-to-day communications requests. So I've also included in here the communication liaison rotating commitment chart. So if this is the plan that's approved, we'll go ahead and figure out a fair way to get folks signed up for 2-month rotation. So from here, we've gone into content guidelines. So what does the collaborative voice look like? And I wanted to keep it fairly simple here, not too prescriptive. So we'll follow the APA style for most things. The exception will be to reflect AP style for media releases. When describing the collaborative, we'll use the language used in the collaborative description, which is page 2 of this document as a guide. And it's not a doctrine, it is a guide. So You might see different variations of it, but hopefully it helps people when they're thinking about what's the best language to use. When listing partner associations, we'll be listing them in alphabetical order. So it'll be AFDO, CDC, CFP, FDA, NHO, and NEHA. For social media, whenever possible, we'll prefer reposting over new posts. This includes asking those sharing collaborative messaging to repost from the collaborative's account, as well as resharing from other accounts whenever possible. This just helps drive traffic to the actual account that posted. The collaborative will only follow partners' organizations on social media platforms. For outside marketing, the collaborative will only share not-for-profit educational outside marketing. And for media releases, we'll use AP style. And then I've included here some brand assets for quick reference as well for when people are designing things to be in the collaborative style. So here we have the colors that we've been using, the fonts that we've been using, and where folks can download them if they don't have them. We also have templates for PowerPoint, letterhead, and meeting notes and agenda templates. Once we have this published, I will make these a link so that people will be able to access those templates from this document.
And they're also on Food Shield as well.
Yes, and they are now in the quad folder as well, I believe, and they're available on Basecamp. So believe it or not, that is actually the end of this document. So happy to open it to more open discussion if there's anything else anyone's thought of as we've gone along, or any other questions or concerns.
Taryn, is there a reason why Oswald is bolded? Just wondering.
That is just the weight of the font.
Oh.
That's why it's
so it's
used
already
for
in
header.
Oswald.
Yes, yeah.
That's good. Thank you.
Sure.
So Taryn, this very well done, and I like that it's only that it's 10 pages. For the rotation of the where they the communication liaisons, should there be an overlap of a month? I mean, I guess I was thinking maybe there would be some things that may not be resolved in a 2-month period that might carry over to the next, and having that, if it's a buddy system, maybe the first rotation might have to have a 3-month for one and 2 for another, and then set up where there's one newbie coming on every 2 months. One of the two is new every 2 months.
That's a really interesting idea.
So it's just to carry over what projects may exist in a 2-month period, so you have someone familiar with it.
Right.
But just a thought. And then the other thing was I talked about earlier was the quad. I think not everybody, even at the collaborative level, knows what the quad is. We talk about it. We know what it is, but maybe just defining that is the meeting of the leads of the 4 associations, and we just use the term quad.
Karen, this is Dave McSwain. Something and again, I would guess the people that developed this document are much better versed, and maybe those are the individuals that we would rely on, to serve as the communication liaison for the various organizations. But if in fact that's not the person, would there be value in having some sort of a training or orientation program for the individuals that will be occupying this role? I guess I look at the flow chart and there's a lot of things going on there. And I don't know, whether it's a process issue, whether it's a content issue, whether it's an expertise issue, but I'm just wondering, given sort of the complexity of all of this, whether or not someone can just kind of walk in and assume that responsibility without having, some at least basic background information. And I don't know that just speaking for CFP, I don't know that we necessarily have someone who would have that skill set without some tutoring.
I certainly think there's a lot of value to making sure that everyone is oriented and has access to everything that they need. I think the one difficult thing with doing that right now is that I think we're all orienting ourselves as we're moving through it. And so I'm not sure that a formal training could be developed at this time, but I do think that that's something that would be really valuable in the future. I think that's kind of the other nice thing about having one position, in this case, the approver, that's not rotating. So there's always someone who knows, you know, what's been going on, what's coming up, is sort of the main point of contact. So any questions or anything can be fielded to that person who should be clued in to pretty much every part of this.
Well, and I think uniformity and consistency is going to be critical, so that that people that submit items are not feeling like that. There's disparity in how they're treated versus how someone else was treated. So having someone or a small group who are sort of there to provide the continuity and the consistency of decision making, I think would be very important in the at least when dealing with things from external parties.
Yeah, I think that's a great point.
And there was a term you were looking for a definition. Was that the communication?
Yes, the communications working group. Sorry, I'll have to scroll way back. There we are.
So is this the original, the group of the leads from each of the member associations and the FDA and CDC?
I think the understanding is that since there'll be a communications team, which is basically made up of the communications liaisons plus the approver, then not necessarily everyone on the working group will be a communications liaison. So just sort of separating those two bubbles.
And for clarity, for our next communications meeting, which is on Thursday, I'm going to try to get some more clarity on our quote charges and our direction and what we're working towards as the communications working group. And I started to bring this up on our last collaborative call, but we were like running really late and I didn't have time to spit it all out. But we had some communications around like what are we doing and what projects should we be working on and are we meeting the goals and because this group was formed before the funding was available, and that's why the people that sit on this group are primarily unfunded. So I'm working to get some communication, some clarification on this group's purpose and provide a little bit more of a structure to it, so that we're not just like, what we should do, create a PowerPoint template. What we should do, create a letterhead template. So we can have more of a structure, and I think that will help clear up the definitions moving forward.
I agree, Laura. Thank you.
I think the other thing that we can think about in terms of moving forward on this document is that we're starting from a place of kind of unknown. And in the beginning, I think we are going to have sort of a relatively slow period that will eventually pick up. So, like we've talked about before, this is a living document that will continue to evolve. And I think as we become aware of where the redundancies really are, we can start to think about how we can resolve those and streamline this process further. And there's a lot of different ways that might look. For example, we might decide we don't even want the communications liaisons anymore, and we might just want to identify one person to be in charge of communications. So it's not done, but I think the important thing right now is to have a starting place. Is there anything else that anyone wanted to bring up or discuss before we move towards closing this call?
I did want to commend the efforts of the communications plan subgroup. You built this plan from a template, and you learned about it as you went along, and you met frequently and provided awesome feedback. And I really think the plan is impressive. It's brief, it's detailed, and I think that you all should be really proud of the document that you've created. And I'm really looking forward to sharing it with the collaborative and seeing what their feedback is. But job well done. I really appreciate all the time and effort that's gone into this. So thank you.
Here, Taryn, I agree, and kudos to you, and hopefully you'll share that with the other members of your work group.
Well, I think most of them were here to hear it, so that is very good to hear. Thank you all.